Abnormal uterine bleeding can be either heavy menstrual bleed or intermenstrual bleeding. In heavy menstrual bleeding, there is excessive or prolonged bleeding during periods. It occurs during regular menstrual cycles. In contrast, bleeding occurs irregularly between menstrual cycles, in intermenstrual bleeding. If A is one cycle and B is the next menstrual cycle, in HMB, heavy bleeding or an increased amount of bleed occurs in these regular cycles. While in intermenstrual bleeding, the bleeding occurs in between these cycles. Other types of abnormal bleeding include postcoital bleed and postmenopausal bleeding. One of the classification systems for AUB is the mnemonic PALM coin. Among these, PALM represents structural causes, and COIN represents non-structural causes. PALM stands for polyp, adenomyosis, leiomyoma, and malignancy. Similarly, COEIN stands for coagulopathy, ovulatory cause, endometrial, iatrogenic, or cause not classified. Based on the age group of the patient, abnormal uterine bleeding has different causes. In premenopausal, some of the causes include foreign body, sexual abuse, precocious puberty, and sarcoma botryoid. Similarly, in women of reproductive age, causes can be related to pregnancy. Thus, a beta-HCG test is commonly ordered in these patients. In postmenopausal females, the most common cause of abnormal uterine bleeding is atrophic vaginitis. It occurs due to loss of estrogen after menopause, resulting in drying and atrophy of vaginal dermal tissue. In these patients, endometrial carcinoma should be ruled out with endometrial biopsy. This wraps up our video on abnormal uterine bleeding. Remember, this video is only for quick review for medical students and professionals and should never be used for health advice or treatment recommendations. Please visit your healthcare provider if you are seeking medical advice. See you in next video. Thank you.